The new push for a universal flu vaccine today. This as we learned from health officials that 3 more people died of the flu here in Connecticut this week. That increases the total for the season up to 14. News 8's Ken Pierce joins us live this midday telling us why one Connecticut lawmaker thinks much more can be done to fight the virus. Good afternoon, Ken.
Good afternoon to you, Keith. And every year scientists change the flu vaccine to try to target the strains most likely to show up. But what if they didn't have to do that? Connecticut's senior senator went to a healthcare center in East Hartford to talk about why more money is needed to develop a universal flu vaccine.
The best way to save money and lives is to get a flu shot.
We are reminded of that every year, but every year we also hear questions about whether the flu vaccine will be effective.
Every year we develop a new vaccine. Every year the docs and the researchers try to predict, part of it's guesswork, what the strain will be next year.
You've probably heard flu types described as H1N1, H3N2. The H and the N are proteins on the virus. There are 18 kinds of H, 11 types of N. Months before flu season starts, scientists pick a few H and N combinations most likely to show up and design the year's flu vaccine to fight them. But some years a different combination shows up and the vaccine doesn't work with that H or N.
But a universal flu vaccine would be effective against all the strains and would eliminate the costs and unpredictability of developing a new vaccine every year.
A year ago, the National Institutes of Health put out a plan to create a universal flu vaccine that would target the things all the strains have in common instead of targeting those H's and N's. Senator Richard Blumenthal says he's already helped secure $250 million to fund that research, and now he's introduced the Flu Vaccine Act, which appropriates $1 billion over 5 years for the universal flu vaccine. That sounds like a lot of money, but the flu has already hospitalized close to 1,000 people in Connecticut, and 14 have died this season.
And it's all the more reason that it's incredibly important that we do develop a universal flu vaccine. And it is fundamentally a cost saver if we can develop that. It will significantly lower healthcare costs.
But that is still a long way off. It's going to take a lot of time as well as money to figure out a universal vaccine. And in the meantime, experts say it's still a good idea to get the current flu shot. Flu season does not reach its peak for another 2 weeks. I'm Kent Pierce. Keith, back to you.